Adam, can you give us a brief outline of what the research is that that you were unsuccessful in getting the MRFF funding for?
Yeah, so it was all about trying to improve best practice care for people after a traumatic brain injury, which is a leading cause of disability, particularly in younger adults. So every year, thousands of Australians end up in hospital after a pretty significant brain injury, and these are often pretty catastrophic events for the person themselves, their families. And what we know is we have the evidence of how to improve care during this phase. We recently developed guidelines around how best to care and rehabilitate people, but those guidelines haven't yet been consistently used in practice. So we've met with clinicians across Australia, consumers, we know that they're not cutting through yet. So with MRFF funding, our plan was to actually take that next step of translating those guidelines into real world care so that we actually could improve patient outcomes, reduce distress for families. Families are often very distressed during this period. We're dealing with people who are often very confused and agitated, and also helping staff who find this period incredibly challenging to work with.
So we've got the guidelines,
Mm-hmm.
but we can't actually apply them because we
Yeah,
haven't got the funding to do that research to undertake that application. Is that basically it?
completely. It's
Mm.
the sort of classic evidence practice gap. And this, so I'm also a clinician,
Mm.
and this is what I find really frustrating, that we have the knowledge, but unless it reaches the patients, what's it for? So we really need this next step. And Australia's been a leader in this field. The evidence for the guidelines has really come from Australian research. But if we don't translate these, we're going to fall behind. Our
And that was
care
going
won't
to
be
be
the
my
best.
question. Do we risk falling behind because of what is ostensibly a reasonably small amount of money in the scheme of things? I
Mm.
think the grant application was for, wasn't it?
Yeah, so it's for less than $1 million. But our plan was to change the way we do care across Australian hospitals. So to reach all hospitals that's manage and support these patients. And it was going to be through staff training and education, tools for the clinicians on how best to care and manage this stage of recovery. But also we know that we need to reach families and help them get through this period, and that was through information and supports. A big gap, we also realised that we can improve how we help people whose first language isn't English, First Nations people. So we're partnering with hospitals such as Darwin Hospital and really across Australia to try and address those gaps.
And it's not that we're asking for more money. I think that's the
Mm,
frustration with the MRFF. It's an incredible fund,
amazing.
and it's not that often universities and researchers are accused of sort of how long's a piece of string when it comes to funding. So it's a small amount of funding for a big bang from money that is already sitting there. So what's the reaction when somebody like yourself, an esteemed researcher who's actually trying to make a difference, you're dealing with people every day, you've
Mm.
got teams of people behind you, you've just talked about the collaboration with like hospitals in Darwin, etc. What's the reaction when you get the rejection letter?
Well, it's incredibly disappointing
Mm.
because most of the people we work with work on the ground with patients as well, and so they can see the real impact of not putting these things into practice. So they want to do the best for their patients, their families, but unless we can upskill staff to deliver care in best practice way, then we're going to miss out, and the patients will miss out. And so it's one of frustration, and we've been working really hard in this area for 10 to 15 years. We've spent a lot of time investing in developing the evidence. We now need to make sure it gets to the people.